Welcome to the Navajo County Connection. I'm your host, Jason Whiting, and today on the show we have Hollis Merrell, Snowflake Unified School Superintendent, and Jeff Lee, Navajo County Health Director. Welcome to the show. We're glad to have you both here with us today.
Thank you.
Thank you for having us.
Appreciate your time. We know that during this season you're both extremely busy and with a lot going on, but I've been really impressed and grateful that both of you are doing what you do as I've seen the work that you've been able to accomplish. So glad to have you on the show today and able to talk about some of the things that have gone on inside your communities and inside your world. So real quick, just for our audience, while we all know who each other is, I'd like to kind of give you an opportunity to introduce yourself and what your role is here in Navajo County. So why don't we start off with Mr. Merrell. Why don't you go ahead and share with us a little bit about who you are and what you do.
Thank you. Well, I'm the superintendent for the Snowflake Unified School District. We serve students in Taylor and Snowflake, and this is my 12th year doing that. So obviously with COVID, my role has expanded a little bit, and we've been doing things that we're not used to doing, but there's really three of us right now at the district level that communicate with the county when we have issues, but we'll get into that later.
So you mean like this COVID thing, that wasn't something they taught you back in school when you were preparing to be an educator?
No.
That wasn't no. Day two, COVID's going to happen and you need to be ready for it.
I've heard people say, I didn't sign up for this, and I don't take that approach. I say, this is what it is.
Right.
I did sign up for this. Whatever we have to deal with is part of the job.
Certainly appreciate that attitude, and thank you. We're lucky to have you. All right, Mr. Lee.
Yeah, my name's Jeff Lee. I'm the director of the County Health Department. I've been with Navajo County now for almost 4 years as the director. And in any infectious disease outbreak, pandemic, it's the County Health Department's role to kind of oversee and manage that response. While this is our world, a pandemic, working with schools and learning what goes on in schools is completely new to us. So we're learning the school aspect as the schools are learning the outbreak aspects. So it's been a great new adventure for both entities.
Learning a lot, but doing a great job, and I mean that sincerely. Appreciate what you guys have done. I have a few questions I want to kind of roll through with each of you guys, and we'll start off these first two. I'm going to go ahead and ask Hollis those questions, and then by all means, if you would, if you'll share from your side of it as well. Sure. How did you prepare for the school's reopening? Again, there was not a playbook for this, so what did you guys have to do?
No, we started in March, obviously, and the nice thing about our county is that Jeff has been very helpful in this. We began meeting with superintendents in Navajo and Apache County weekly, and Jeff also has had a weekly update for us, and really just reading everything we can, following the numbers, and looking at everything we can get our hands on, and that actually became a little overwhelming to the point where we had to just really stop and make some common sense decisions. And we met with our leadership team at the school. That includes about 15 of us weekly during the summer. That's not common. We usually don't meet very often in the summer, and we have great people that we're also following things, and we make those decisions together. And obviously we had to follow the mandates that came out as the governor made some of those came out with some of those mandates and other things, executive orders. Sure. That he had.
It's hard too, because I know that there was executive orders and then there was things that were recommendations.
Yes.
And trying to filter between the two difference and knowing what to do there, but you guys have done a great job. Yeah. Jeff?
Yeah, and just to build on that a little bit, we started meeting early in March. We knew that there were going to be some tough decisions to be made, and we wanted to make sure that we were all in coordination and collaboration and had a unified voice to the community. And explaining and understanding and diving into those executive orders and the mandates and recommendations was our goal for the superintendents, so that we could help them make the decisions that they needed to when it came to reopening schools.
Well, thank you for your efforts on that. One question that's important before we go into some additional ones, but what is it that you want parents to know about this?
For me right now, first off, I would just say thank you. Obviously, decisions we make aren't going to make everyone completely happy, and we understand that, and we we want to make sure we listen to all viewpoints. But we want to thank our parents mostly because they've been just very, very supportive, very helpful through this process. Doesn't mean everything has run perfectly, but that's the main thing. I want to thank parents for helping us following the guidelines we have, the masks and the other things we have at school, because we couldn't do it without the parents' support and making that happen. Secondly, let's continue to work together, continue to communicate when there are issues, and keep students home when they're sick, doing those things that we need to do to continue to decrease the impact of this. Those are really the two things that I want to say to parents.
Thank you for sharing that. Jeff, anything in addition?
I would echo that statement. A thank you to the parents, a thank you to the students for being flexible and understanding with the rapid changes that have happened from COVID. The recommendations change, the guidance change, and just being flexible and understanding with us that we're working through this as they are. And so it really is a big thank you to everybody, parents, students, and staff.
Yeah. One of the great things about Navajo County and the area that we live in is that we really do have a community that comes together and tries to find solutions. And with leadership like what we have in both of you, it's been a great experience. I actually have children. I'm in the Snowflake School District, and the communication has been key for us as parents to understand what the expectations are and how to properly engage and work with our children within the structure that's there. And it's been very much appreciated. I know that you guys have worked together, but I'm sure that many of the parents out there really appreciate the way that all of our schools are working with the county health team and working with our students and our parents. So thank you so much for that. Jeff, let's talk about the current state of COVID here in Navajo County real quick. Do you mind giving us a quick overview?
Yeah, so over the past month, we've seen some really positive numbers. It's leveled off. It's been sustaining around 10 new cases per day, which is much better than what we saw in June and July when we had 60 or 70 cases per day. So right now we have a total of 5,781 cases, and unfortunately today we had 11 new cases. We'll continue to see new cases. What we really encourage is to continue doing and following the recommendations for personal precautionary measures. Those will help us keep those numbers down, and we're meeting all the benchmarks for schools to reopen, for phased reopening on some of the high-risk businesses. So we're definitely in a really positive spot right now. We just have to kind of keep the pedal to the metal and keep doing what we have been doing.
Well, thanks for sharing that. Vigilance sounds like it's the message there, and people being on top of it. Now, while all these different precautions are being taken, obviously there's opportunity for something to occur. And Hollis, do you mind talking a little bit about what it is that you guys do and working with the public health department when somebody within the school district actually does test positive or was in close contact? What is that process right now?
Sure. And I want to say that us choosing to go back to school in person, we agonized over a lot of these decisions, and that's the reality of it, because there's challenges with any option we chose with COVID going on. And we knew that having in-person schooling, we would have some cases, and we wanted to do the best we could to minimize that risk. I was thinking as I came in here today that we have close to 3,000 staff, students, and contracted employees in our district, and the 6 cases that we've had, we'd have another one now is, I can't do that math in my head, but it's a whole lot less than 1%. And so yes, we've had some positive cases, but overall I think we're okay. I mean, there's going to be cases whether we're in school or out of school. I don't want to minimize the COVID by saying that, but I think we're doing pretty good. But I think we've become a little more comfortable now as we've worked these last few weeks in how we're communicating, but certainly we lean on the county health department to do what they do best. We're not health officials. We do have an RN that supervises all of our health techs at our school, but really it's each case we communicate. We talk about who may or may not have been in contact. We talk about how long they'd need to quarantine. Again, we lean on them for some of that information. But really, it's just staying in contact. We actually have begun contact with them on possible cases. If somebody says, "Hey, I'm staying home because I'm sick, and these are my symptoms," there have been some times that we've began communication before we even had a positive test. And so it's just that constant communication. We've tweaked a few things that we've done. We're communicating with parents as well now, where initially it was just the county, and I think that's working a little better, but it's really constant communication. And then again, Jeff does a meeting once a week for all the superintendents in Navajo and Apache County, and the Apache County Health Director is also on that call. So it's really just constant communication and making those decisions based on, you can't say this is what's going to happen in every situation, because every situation's a little different.
It sounds like you guys have worked on a plan in place, though, and what I'm hearing from you is you, in fact, the school, are making the choice at Snowflake School District that you guys are contacting the parents and notifying them if there's contact, if there's potential there.
That's correct, but that doesn't mean that the Navajo County, the nurse assigned to that case, won't contact them as well.
Good. So there's a good team effort there. Yeah. That leads to the next question, Jeff. What is your role, what's the county's role then in partnering with the school district when these things happen?
Right. So really our role is the disease investigation. We want to do the disease investigation and contact tracing on the case. And the contact tracing is there. It's a tool that we have to try and stop the chain of infection. And so what we'll do is when we're notified of a potential positive case, or we get notified from the school of somebody who might be calling in sick, who has some symptoms, we jump on it immediately. We have a team of nurses that are dedicated to schools, and we'll start looking at, what are the particulars of that scenario? How close were people? What were the mask mandates? What were when was symptom onset? So that we can get a very quick, accurate snapshot of that potential case, so that we can stop that chain of infection by isolation and quarantine. And then working with the schools on symptoms and just routine education on, again, the updated recommendations from the CDC or ADHS. Just really communication has been the key to all of this.
I want to dive at that just a little deeper, if that's all right with you. You talked about, so getting a little more specific, just to give an idea to those folks that are watching, you talked about communicating with the parents and being able to share the information, but let's talk about contact tracing. Mm-hmm. So let's say that there's a class, and explain the difference to me here. It's a class that's at the elementary school when the kid is in the classroom with the same group of kids with the teacher all day long, versus somebody in the high school where it's not, where they're in for a shorter period of time with the same group and then move around and do. Yeah. What's the difference in the contact tracing side for your team in those?
Yeah, so, well, with the elementary kids, it's challenging because we're relying on elementary kids' recollection of what his day was, and that can be challenging. But then we look at, one of the main things that we look at is time of exposure. How long were you potentially exposed to somebody who has COVID? And in an elementary setting, it's a much higher risk that you're in the same classroom for multiple hours. So the risk raises in those scenarios. But each case is so different. It's so hard to put a blanket plan for each case that we could have, a high school student who has a classmate that they follow around all day. They're in the same class every day. Well, the risk is the same for those two individuals that it would be for an elementary student. So really getting the details of everyone's day who was within close proximity of that case X or case index case, however you want to call it, but it's key that we get on that early and fast so that we don't spread. We eliminate the potential of more spread within that school.
Perfect. No, it makes sense, and I appreciate you explaining. I think that gives a little context for people as far as the complexity surrounding it, because it's not all are created equal. What they experience and at different schools is very different as far as what the exposure is. It's not a generic, hey, you tested positive, so everybody that you ever potentially looked at that day is also getting contacted and also has been put in quarantine. Yeah. But you're really drilling down to make specific decisions is what I'm hearing.
Yeah, and we will contact more people than we have to. I mean, sure. Or need to, because we want to make sure that we look at all angles, all possibilities of exposure, and then narrow it down to the, handful of folks that are those close contacts that are going to require some additional monitoring.
Perfect. Thank you. So carrying, kind of piggybacking on that, somebody tests positive inside the school district and now has, what is the communication plan? Because you talked about the schools communicating now. What is the communication plan at the school with the teachers as well as the students and the parents?
It's pretty basic. I can share that. First, I mentioned previously 3 people. So myself, our district nurse, and the site principal are really the team that, from our end, that makes decisions. I'm not the one that will be contacting parents. Usually the principal, sometimes the our health director, our nurse also will have some communication with parents. But really, we send out a general letter. We cannot be specific due to HIPAA or FERPA laws. And to the parents of that school, we're not sending them out to the entire district, just to that school. And then calls to the parents whose students might have a higher risk. If they're in the classroom or they're maybe hanging out with them at lunch, if they're a high school student or whatever the contact tracing reveals, those parents get a phone call. And that's basically it.
No, that's helpful. And if you don't mind, I'm going to take a question to Jeff based on something that you just said. He talked about HIPAA a little bit, and I don't expect you to be an attorney and go into it a lot, but I think it's important for the public to understand with HIPAA, people are upset. I hear people get upset from time to time as far as, well, why can't you give us names? Why can't you give us the information? And do you mind explaining what HIPAA is and just briefly, a high level, what HIPAA is and why you can't sometimes share that information, Jeff?
Yeah, so I mean, basically HIPAA is the protection of information for patients or somebody who, any health type data or information on an individual. So we don't release much information when we're talking about outbreaks or when we're talking about plague or any type of scenario where an individual could be identified through the information that we provide. And that's really what it is. We could list a city or a town, and if we're having small numbers and an individual is identified through what we posted, it's a HIPAA violation. So we're very vague on an individual's status as far as health, but we try to get as much information as we can so that the public is aware of a particular event. We just can't give the particulars, and it is challenging.
I can see that, and thank you for being willing to talk about that, because I recognize in my own conversations, as well as conversations I've had with each of you, that can be a roadblock because people feel like you're asking all kinds of questions of them, but yet can't be very responsive to their questions. But there are literally laws surrounding that to protect those individuals that limit your ability to do so. So thank you for adding some context around that. If you don't mind also sharing, what are the specific steps and procedures? What are you doing to partner with the school districts right now?
So the first thing that we did is we set up a weekly Zoom meeting with all the superintendents in Navajo County. That has paid off tenfold. I mean, we started in March, and now we're meeting up to twice a week. And just that constant communication, open lines of communication, really built the trust and an understanding of each other's organizations. So that was the first thing. And then specifically when schools started reopening, we went out, made ourselves available to the school board meetings when decisions were being made. Again, just opening that line of communication and explaining from the health department's perspective what COVID looked like in our community. And then now we have a team of nurses that only work school-related cases. So it's a consistent message. It's not spread out amongst 20 different staff members. The staff working schools are trained specifically for the schools. We also have a hotline that are available to the schools. so that if they have any scenario that they want to run by us, they just give us a call, and we run through that scenario very quickly with them, so we know how to react. It's been going on for so long. What else have
It has. I would, this is the first time I've met Jeff in person. But I've seen him on Zoom meetings going back till March. So we've been really appreciative, because before we had cases, we had a relationship and understood each other. So that was really nice, and we appreciate them being willing to do that. That we sent out a joint press release last week. I sent a draft of that to Jeff, and he made a couple of suggestions that I tweaked, and it was around the privacy too, to just making sure that we're not breaking any of those laws that we have to follow as well.
Well, for what it's worth, and I have some more questions, but I want to thank you both sincerely. That's what partnership to me looks like, and when we're able to communicate and lift and build and work together, we really get a better result. And that's all that I hear from Jeff as he's reporting to us as a board, but is the positive efforts that are being made and the back and forth that's going on. So thank you both for building that structure, creating that trust, and finding solutions that really drill down to our kids and our parents and the results that you're trying to get at the schools and the success that you're seeing in the numbers. So thank you for doing that. I've got another question for you.
Can I add one more thing to
please,
this?
Please do.
What I was going to mention is that our superintendents in this area work very closely with each other and have for a long time. We're recognized outside of our area as a very organized, proactive group, and so it's been really nice to have at least 2 weekly meetings where all of us are on and can share ideas and, hey, how did this work for you? And so I'm grateful to all the superintendents in Navajo and Apache County being willing to work together on this too. It's not just a partnership between us and the health department. It's really a group collective effort.
That's a great idea, and thank you for bringing that up. I think that'll help the public to understand exactly how the schools and everybody is working together to elevate what's happening live and making adjustments based on the events that are occurring. So thank you for sharing that. So let's go back to talking about when a child, heaven forbid, that they actually catch it. So the child has to be on isolation. How does a child deal with homework at that point?
It's the same as if a student got the flu last year before COVID. Our teachers will continue to work with them to send the homework home. We do anticipate that some students will have more absences this year than normal. We know that. We know that we want parents to keep them home if they're questioning whether they should be there. Typically we have students at school that might have a cough or a runny nose, and so we anticipate more absences. That's a good thing this year, even though it is more difficult to learn when you're at home, and certainly we want kids in school. But our teachers will continue to work with them. One of the questions that people have asked is, can they switch to online and then back to school if they have to be isolated or quarantined for 2 weeks? And the answer to that is no. It's 2 different platforms. It doesn't work, and the classroom teacher doesn't run the online portion, and so you have to continue that relationship with the classroom teacher if you're home for an extended period of time. So far I think it's working. I obviously don't know every specific situation, but it's no different than when a student is normally sick at home.
Thank you for sharing that. I think that's important. Jeff, coming back over to you, in order to keep the numbers low, and it sounds like so far there's been some success around that, if you could share anything with parents so that hopefully this isolation doesn't have to occur, what are things that you would encourage them to continue to do?
So I think the biggest thing is staying home or keeping our kids home if they feel unwell. And not so much sick, but if they're just not feeling right, now's not time to push it. We want to keep the kids home, give them a little extra time, and make sure that it's not COVID before we send them back into the classroom. Most of our cases are linked back to a workplace or a school exposure, and unfortunately exposures where the individual came to work knowingly not feeling well. So allergy season, flu season, crud season, I mean, there's always a bug going around. And we're just built to push through that and go to work and go to school, but this is just not the year to do that. So just take that extra precautionary measure, and if your symptoms aren't alleviated by over-the-counter medicine, then it's time to seek some medical professional advice and see if you need to get tested or not.
So I hear the scientific term crud. Was that the crud season?
The crud season.
So we're starting to run short on time because I want to ask you both one last question, and I'll first let's go with Jeff, and then we'll come back to you, Hollis, on this. If you could share one thing with this last little bit of time that we had that you want to relay to parents and students, what would it be, Jeff?
So one thing that we're really running into is the information that we work off is only as good as the information that we get from the contact tracing investigation. So if you are contacted by public health, just please be as open and honest with them and try and give them all the information that they can. All we're trying to do is eliminate that infection and try and keep the exposure as minimal as possible.
Thank you. Hollis, same question for you. One thing you could share to parents and kids.
I will. This is hard. This is not easy. We recognize that. It's not easy for any of us, but our staff, our teachers are very excited to be at school right now, and that says a lot about the teachers we have, and I know that's true around our area. But really just continue to communicate with us when there's an issue with your child. Keep them home if they're sick. We're continuing to wear masks in school to help minimize that exposure. And by the way, it's a whole lot easier when you do the contact tracing if somebody's followed those guidelines with the masks and so forth. But really, if there's one thing, it would be just continue to communicate with us. We have to communicate between the county and the schools, but we also need that communication with the parents.
Thank you for sharing that. I think that the insight's extremely important. You shared something very insightful as far as when they're doing the contact tracing. If people have been following the precautions, it limits how many people really have to be isolated or have that experience, and so it helps to keep the numbers lower, and that was the whole intention of this. I want you both to know that your leadership is recognized by our communities, and it's certainly appreciated. So thank you for what you're doing in a difficult season. I know that, as you had mentioned, it's not just while you're representing superintendents here today. All of our superintendents have been involved, engaged, and are looking for better ways to be able to help educate our children. And Jeff, thank you to you and your team. If you'll be sure to relay that back to both, we really sincerely appreciate that. So thanks for your time today here on the show. We're always glad to have you. Hopefully we'll be able to talk here in the coming months about, in hindsight, what it was like to have COVID.
That would be great.
Anyhow, we're really glad to have you. Thanks for joining us on Navajo County Connection. We'll see you next month.